Welcome back to WTOL 11 Your Day. May is Mental Health Awareness Month, and there's a lot that goes into being happy and healthy when it comes to your mind and emotions. And it's not wrong to get help if you feel a little off. The Thomas W. Wernert Center in Toledo can help. Sarah Berendt joins us this morning. Thank you so much for joining us. We're looking forward to this week and really getting the word out about the importance of our mental health and trying to break away at that stigma that just seems to be associated with it.
Thank you for having me. It really is such an important topic that we talk about.
Yeah, so I think this morning what we want to focus on is peer support when we're talking about our mental health. What exactly is peer support?
So peer support is it's a newer idea in looking at treatment for mental health challenges. So it's really about having people who have lived experience with their own mental health diagnosis, kind of helping support others along their journey. So like here at the Wernert Center, we are an entirely peer-run center, which means that everybody who works here, almost everybody has lived experience with their own mental health diagnosis.
So they understand, there's I understand what you're going through, and there's that compassion that can build through getting that treatment and working through those issues. So yeah, I think that is unique as well in treatment and having that support system there for you. And what is the importance of having that peer support as folks are going through recovery?
Yeah, so like you said, a lot of it is about that connection and that shared understanding of those experiences. Sometimes it can be really hard for somebody who hasn't been in that position themselves to understand the challenges that we face when we have a mental health diagnosis, the challenges that can come with even just daily things like getting out of bed or showering or finding those supportive systems. So with having peer support, we can really understand and truly say, like, we have been there. These are things that have helped us. These are things that have helped other people at the center that might be able to help you. And we can support them in their journey kind of in a different way than what like psychiatrists or therapists or even case managers can, because it's a lot easier for us to say, like, we've been there, we get this, how can we help you? Let's stick with you along this journey.
Yeah, and I think if people hear someone say, I've been there and this worked for me, that gives them a little bit of hope, a little bit of inspiration to say, you know what, I can get through this, and I am on this positive path to recovery. So that is really important. What type of activities do you all do there at the Wernert Center?
So we have a wide variety of activities. We've got a fitness studio, we have an art room, we've got a computer lab. We do activities out to the community. So we'll go bowling, we'll go out to eat, we'll go to coffee shops. We have classes here so that we can talk about recovery-oriented topics. So we can talk about crisis prevention, mental health literacy in general. So what exactly is going on in our bodies and brains when we're having these experiences? We'll talk about nutrition and exercise and the importance of that overall healthy lifestyle to support your mental health and your physical health, because it's all connected.
It absolutely is. How can someone become a member? Is there a cost associated?
So we do encourage a $5 annual membership fee. But in order to become a member, you can contact us. Most people are referred through their case managers, but you can feel free to reach out to us. In order to qualify for a member, you have to be over the age of 18, live in Lucas County, and then currently be receiving services for a mental health diagnosis.
Okay, and as you said, and in many of those cases, there's a referral there that helps streamline that process. Wonderful. Sarah, thank you so much for joining us this morning. As I mentioned, an important topic we're going to be discussing all week because we want to make sure that we're taking care of ourselves and that it's okay to talk about these things, right?
Exactly. It is okay. And especially we've seen through the pandemic, everybody has mental health,
yes,
whether they have a diagnosis or not. So it is okay to talk about these, and it's important to talk about these topics.
Very good. Sarah, thank you so much for joining us this morning. And if you are struggling with your mental health, there are people who can and are more than willing to help. Text the word support to 419-248-1100 and we'll send you a link to resources that are available to you. WTOL 11 Your Day is back in a moment.